Hello and welcome to my health channel. Today I'm going to talk about menopause. Menopause is part of women's health. Menopause is simply a normal and natural part of aging. It can be a positive experience for some women, and for many, menopause can be a significant negative impact on a woman's health. Menopause refers to when a woman stops to have menstrual period. A woman is said to have a change of life, and quite simply, menopause means end of monthly periods, end of monthly cycles, and end of menstruation. It is a gradual process when a woman's ovaries stops to produce the hormones, namely the estrogen and the progesterone. With menopause, periods don't just stop. Many women who have gone through this process or phase can testify to that. Some women would have had menopause when they have not had a period for 1 year or over. For some women, it can take several years to go through complete menopause. So when you hear a woman says, I have not had a period in over 1 year, it's obvious that the woman have gone through with it. For those women, especially outside menopause age group range, it may be a sign that something does not appear right and may lead to further investigations. Please do always speak to your doctor for advice, and it is the doctor who may decide to trigger off further investigations. Women usually go through menopause between 45 years and 55 years. Menopause can happen earlier naturally or for obvious medical reasons, for instance like premature ovarian failure, hysterectomy, chemotherapy, fibroid embolization, stress, and many others. Sometimes early menopause is likely genetic, likely inherited. Chromosomal issues for people born with incomplete chromosomes, like Turner syndrome, can bring on early menopause. 1 in 100 women experience menopause before the age of 40 years of age. This is what they call premature menopause. It is important to note that sometimes as soon as a woman starts to experience irregular periods, that periods that are noticeably longer or shorter than a typical cycle, please contact your doctor to check for any other issues. Symptoms of early menopause is similar to that of normal menopausal symptoms. So I'm going to talk about two symptoms here. One is going to be the physical symptom, and one is going to be the mental symptoms, that women experience with menopause, or when they are undergoing menopause or going through that process. Understanding symptoms and how to moderate them can make transition to a woman's midlife a lot easier to manage. So it's important to talk about the many changes in a woman's body. We also know that decreased production of the two hormones I mentioned earlier, the estrogen and progesterone, can cause the following symptoms. 1, headaches. Hot flushes usually last for a few minutes. It usually flushes on chest, neck, or face. Some people sweat when this happens. I've heard some women say they felt sick, weak, very anxious, or even had palpitations. Sometimes this flush or flash can happen many times in a day. Some women also get it before menopause starts and can last for so many years. Some sweat at night during sleep, and it can wake them up and they feel soaked, that they have to change their clothes and their beddings. Some have what they call joint pain. Some have vaginal dryness. Some people lose their sex drive, loss of libido. Some have sex during intercourse. Some get very tired and lethargic. Some become very irritable. They have insomnia, difficulty sleeping, aches and pains in their joints, weight gain, itching on the skin. Some have thinning and graying hair, and some have what they call recurrent urinary tract infections and breast soreness. With the mental health symptoms, they have changes to their moods. They have anxiety, depression, mood swings, low self-esteem, problems with memory and concentration. They call it brain fog. Okay, so menopause symptoms last an average of 4.5 years following the person's last period. This is according to a study which also suggests that the healthcare professionals advise people to expect a 7-year duration for their symptoms. So, what are the problems associated with menopause? Skin and hair. Women tend to lose collagen, which is the skin protein, which leads to dry skin, thin skin, and the skin that itches. Okay, now some women tend to have what they call thinning and graying of hair. Some have genital area problems, so the lack of hormones such as the estrogen. When this happens, the woman will notice in and around their vagina will become thinner and drier. Okay, they pass urine more frequently, and this may leak. They experience some pain during sex, and the vagina may shrink a little or expand during intercourse. Okay, so these are then some women have thinning of bones. I'm sure you hear about what they call osteoporosis. Estrogen helps protect against bone loss. Less of this hormone is why people have joint pain. The loss of estrogen, which has a protective effect, puts someone at risk of heart and blood vessels, cardiovascular disease, really, which includes heart disease and stroke. The, um, there are benefits that come with menopause, which includes women stop buying tampons or pads, they stop to bleed, and they don't spot unexpectedly anymore, and they don't have any more fear of pregnancies. Okay, now there will be some tests that people have to do to diagnose menopause. Doctors use symptoms like hot flushes, usually the first signs, and the hormone and blood tests, especially in women under 45s. Blood tests if a woman does not have symptoms, which are typical of a woman with menopause. Then this the blood or urine test is used to determine hormone levels, such as estradiol, the follicle stimulating hormone, which they call the FSH, the luteinizing hormone, which they call the LH. Okay, so how can we alleviate symptoms of menopause? Well, there's the HRT, which they call the hormone replacement therapy, which they use to treat and alleviate the symptoms, but this depends on personal and family medical history. Okay, this therapy replaces the estrogen that the ovaries stop to make. Doctors may recommend the lowest dose of estrogen to provide symptoms of relief. The HRT comes in form of tablets, skin patches, nasal spray, pessaries, vaginal rings. Okay, and the estrogen is delivered in a set dose with or without progesterone into the bloodstream. Some women get urinary tract infections. They are given a treatment that women can insert into their vagina, which is in form of cream. It alleviates vaginal dryness and urinary symptoms. Speak to your doctor if you have any of the symptoms. Okay. Now we have what they call the cognitive behavioral therapy, CBT. This is a talking therapy that can help with low mood and anxiety. Okay, naturally you can use the following to reduce symptoms: foods rich in calcium and vitamin D, maintaining moderate weight, eating lots of vegetables and fruits, avoiding trigger foods, drink enough water, reduce refined sugar and processed foods. Okay, eating a healthy and balanced diet and exercising regularly. This can improve menopausal symptoms. Okay, so what I'm going to say here is there are things you may not want to do, and if you do them, they might worsen your symptoms. Please don't smoke. Okay, don't drink more than the recommended alcohol limit. Okay, and to confirm menopause is over, the follicle stimulating hormone, which is what they call the FSH, will rise. Okay, and the ovaries will begin to shut down. Okay, my next topic will be on the male menopause. It will be so interesting. Okay, thank you for watching, and please share to every woman you know. Please subscribe, like, and comment. Thank you very much. Press the red button. Bye.